Hello, everybody, and welcome to Medicine and Science on the Pod TV network. I'm Nick Palavita. I'll be your host for today's presentation. And today we're going to be looking at some very important topics dealing with vaccines. The flu vaccine, we're also going to look at the COVID vaccine, the measles vaccine, and no, RFK will not be speaking because he's not a medical doctor. Matter of fact, he's board certified, to my knowledge, in nothing relating to medicine. Instead, we actually like to talk to doctors when it comes to medicine, not attorneys that specialize in environmental law. So with that, we do have a board certified physician who is board certified actually in internal medicine and actually practices medicine, none other than Dr. Michael Patmos. And he's going to explain the vaccines and the necessities of having vaccines as opposed to an environmental lawyer. So like I said, for me personally, I like to get my medical opinions from doctors, but not from lawyers. I'm a lawyer and I wouldn't recommend that at all. As a matter of fact, one thing I agree with RFK is nobody should be seeking medical advice from him. That part I do agree. So Dr. Patmos, the vaccines, what about them?
Good morning, everyone. Yes, so I am board certified in internal medicine. I also have added qualifications in infection control and in hospital epidemiology. And I'd like to update the viewers today on what the latest recommendations are for this season for respiratory immunization. It is mid-October, and the season is upon us. Within a few weeks, usually by November, certainly by Thanksgiving, we will be knee-deep in influenza and very likely COVID as well. The summer surge of COVID is just tapering a little bit, but when the weather gets colder, people huddle closer together inside in their homes and other places, gather together for the holidays. The average distance between people decreases and the risk of respiratory infection increases. So this is the time of the year to get vaccination. And what vaccination should you get and who's recommending them? So let me fill you in on the latest recommendations. So first of all, there are 3 vaccinations. There's the influenza, RSV, and then the COVID vaccine. And surprise, surprise, many people thought that CDC was going to pull the recommendation for COVID vaccination. Now that the CDC has an ACIP committee headed up by Dr. Malone and other anti-vaxxers, all the anti-vaxxers were excited that it would be the end of the COVID vaccination. Well, lo and behold, CDC, ACIP voted to recommend COVID vaccination for everyone, basically exactly as was recommended before, with the caveat that it should be after discussion with your doctor or your healthcare provider, which is always the way it's been. So basically, CDC just reiterated the previous recommendation. And so here's the recommendation. All children aged 6 to 23 months should be vaccinated. Children between 2 and 17 years of age, especially if they have risk factors. All adults should be vaccinated, especially elderly people, anyone in pregnancy, and they should do, so that's the official recommendation from CDC, from the American Academy of Pediatrics, the American Academy of Family Practice. Let me say that once again. Robert Malone's committee voted unanimously to recommend COVID vaccination. Why did they do that? Because the evidence is irrefutable. This vaccine provides up to 60% protection, additional protection against severe disease, and 90% protection against death. And that's the reason we vaccinate. We vaccinate to prevent severe disease and death. And it's the vaccines that are recommended is the Pfizer and Moderna messenger RNA vaccine. RSV immunization is important and recommended by CDC and American Academy of Pediatrics for all infants less than 8 months of age and for children between 8 to 19 months with risk factors. pregnant women between 32 and 36 weeks gestation, and then adults age 75 or over, or adults age 50 with risk factors. This vaccine reduces severe disease by 80 to 96%. If you've ever seen RSV, children can die of it. It is a really, really bad respiratory infection. Um, and so it's important for those groups in particular to be vaccinated. What about influenza? CDC and American Academy of Pediatrics recommends influenza immunization for all children 6 months of age and older. All children 6 months of age and older. All pregnant people, adults 18 to 50, all adults 18 to 50, and adults over age 50 should have a high dose recombinant vaccine, basically a double dose, stronger dose for those who are over age 50. This vaccine works well and reduces the risk of getting sick enough to go to a doctor by 30 to 60%. This is important because, people have this idea that if a vaccine isn't 100% effective, that it's not worth taking. These vaccines, 30 to 60% reduction in severe disease is really good. If you can prevent, we're talking about millions of people getting infected. And if you can reduce the severity of disease by 60%, that's a lot of people who benefit from that. So these are the recommendations for the vaccines, and this is what is recommended by the experts. And so I'm sharing what the experts recommend. And I want to point out one more time, the CDC, ACIP voted unanimously 2 weeks ago to recommend COVID vaccination for everybody. So there you go. It hasn't been taken off the market. And for those people who've been so convinced that the vaccines were going to go away and that CDC and Malone would yank them, that didn't happen. Now, I have a quick update about measles. Measles is popping up all over the country right now. The Texas outbreak has subsided some, but it's now in Utah, Arizona, Minnesota, and North Carolina. There are confirmed nearly 1,600 cases of measles in the United States just this year alone. We haven't had measles in 30 years, and now we've got 1,600 confirmed cases. The reality is, for every confirmed case, there's one or two unconfirmed cases. So it's suspected there's as many as 5,000 cases of measles in the United States right now, and it's increasing. It's important because measles kills, and measles leaves you with a high risk of, or a high increased risk of, severe brain damage later on. It's a very bad disease. It's extremely contagious. It's completely preventable. And the United States has turned back the clock decades. We're now in the middle of a measles national outbreak. Now, here's the point I want to make about this. You can connect measles outbreaks by looking at the genotyping of the virus. Viruses have a structure, and that structure is specific to the virus. It's like a molecular fingerprint, if you will. We know that the measles virus that's popping up now in Minnesota, North Carolina, Arizona, and Utah is genotypically connected to the outbreak in Texas. And we know that Texas and Louisiana shared a genotype. But what's interesting, and that all happened earlier this year, but let's remember the podcast we had just last year. We talked a lot last year about measles outbreak in Florida, and Dr. Ladapo's shocking recommendation, where he said that children who have been exposed, don't worry about quarantining them, let them go to school, leave it up to the parents. That I predicted. If you go back, I warned us last year that would lead to spread of measles outside of Florida. Well, shortly after that, measles popped up in Louisiana and in Texas. But here's the interesting observation. Florida, if they did genotype the virus, they have not released the information to CD. I can't find it at CDC. I can't find it anywhere. It appears that Florida is withholding the genotyping information of the measles virus that showed up last fall. And it's very reasonable to ask, is the current measles virus that's going around the country connected? Is it related to the virus that was in Florida last fall that Ladapo allowed to run wild, and they're withholding the genotyping information? I don't know. That's speculation, but I'm concerned that it is.
So Florida has a record of playing games with their medical information. With COVID, they did whatever they could to hold back embarrassing information about their death rates.
Yes.
And so I wouldn't put it past them. So I'm looking at the CDC website. Measles outbreaks this year in 42 states. And the last year that had more measles cases was 1992.
Yes.
And it's only October. We could still break 1992's record.
Yes, I think we will, and I think it's just so sad because this is a disease that no one needs to get. That vaccine is 99% effective. It's a really good vaccine, and there are children who will suffer very bad adverse consequences from this outbreak. And I think there needs to be an investigation. Yes, Ladapo has manipulated data before. That has been established. But there needs to be an investigation right now as to whether or not Florida has the genotyping information about the measles that they had last year, and if it is connected. Because if it is connected, then Ladapo is responsible for this.
Well, you have to be fair to Florida. They are busy in Florida. The governor has been, now there are rainbow crosswalks across Florida in memory of the 50 people shot at the Pulse nightclub by a psycho, where they would paint, instead of white stripes, they've painted a rainbow. So DeSantis, the governor, has been industriously jackhammering intersections that dare to have colorful crosswalks. So, they priorities.
Well, anyhow, so hopefully you find that all useful. I'm a doctor. I've been a doctor for 45 years. I just got my 9th COVID shot. I've gotten a flu immunization every year since I was in medical school, and I saw a young, healthy 26-year-old man, father of 3, die from the flu. I remember it vividly. I was a medical student. I was assigned to him. I think it was 1977, and I did his history and followed him in the ICU. And I was there in the waiting room outside the ICU when the attending physician and I, as the student, went in to tell his wife and 3 children that he was dead. And I'll never forget the wife's words. She said, "But he was so young and healthy. How can anyone die of the flu?" News for you: influenza kills young, healthy people.
Yeah. Dr. Patmos, doesn't influenza kill a lot of people in general? I mean, we're not talking 5,000. We're talking about 30, 40, or 50,000 people a year. Isn't it that large amount of people that die of influenza?
Yeah, it's there's about anywhere from 10,000 to 50,000 or so deaths confirmed here. Now remember, those are confirmed deaths. There's always more than that because, now let's say a person gets influenza and they don't go to the doctor and they die at home. It's natural causes. So it's more than that. Yes, tens of thousands of people die of the flu every year in the United States.
So like with COVID, 80% of the people who are killed by COVID are 65 or older. With flu, what's the age profile?
Well, it's interesting. It depends on which flu you're talking about. The flu we see, the seasonal flu we have now, also is very hard on small children and elderly, older people with chronic disease, diabetes, lung disease, and so forth. But don't forget, influenza can also, the Spanish flu of 1918 to 1920 preferentially killed young, healthy men. So, the idea that influenza only gets the old, and is not true. And even with COVID, 80%, most of the deaths were in older and chronically ill people. 20% is still a big number. 20% of 300 million people is still a big number.
Yeah, and people like to say, with the COVID apologists, minimizers, everything's okay. It's just a cold. They like to say, well, it was their time. Well, that is in my mind is bullshit. Just because somebody has diabetes or
Right.
heart issues doesn't mean that they deserve to die if they get one of these diseases. The statistically I read, and I don't know if it holds up over, this was years ago, that COVID took away 10 years on average of life of the people it killed.
Yes,
Mhm.
it did shorten people's lives. It took people prematurely, and it's dead people don't speak. And there's 1.2 million Americans who won't be at the Thanksgiving dinner this year. 1.2 million Americans who won't be at Christmas and Hanukkah celebrations this year, and nobody speaks for them. And it just kills me as a doctor. I've spent nearly half a century working in hospitals and medical offices, taking care of people from the medical wards, med surg floors to ICU, and working in the ER and working in offices in primary care and also in telemedicine. And for half a century of taking care of sick people, and I have to listen to people who never go in a hospital, who have no background, no training, and don't work in the field, don't know what it's like to see someone die in an ICU after they've been on a vent for 6 weeks or 8 weeks. What a trauma that is for the patient, for the family, and it's traumatic for the caregivers, especially when we're taking care of people that we know didn't need to get sick.
Mhm. Yeah. So when people do have an opportunity, like I did, to get a flu shot, which I did last week, isn't that more beneficial than saying, "Hey, I'm going to take a risk that I get the flu and I recover," as opposed to like I did, I went ahead and took the flu shot, figuring that it's better to have the flu shot and have a little pain in the arm, which wasn't that bad, as
Right.
opposed to take a risk of getting the flu. What's your thoughts on that?
So yeah, I think people get confused between what is influenza and what is nasopharyngitis, the common cold. It's really
Mhm.
important. These two illnesses are very clinically different in their appearance. The flu does not manifest like a head cold. The manifestations of influenza are the characteristic ones are abrupt onset of high fever. I mean abrupt. You can be fine at 8 a.m. in the morning, and by 9 a.m. you have a fever of 103. So it's abrupt onset of high fever, intense myalgias and achiness. You feel like you've been beat up by George Foreman. Every part of your body hurts, and you become prostrate. You cannot get out of bed. That's the presentation of influenza. It's not the sniffles. It's not a runny nose and a sore throat. It's not a head cold, contrary to what the commercials for Theraflu make it look like. That's not how influenza presents. Influenza presents with abrupt onset of fever, intense myalgias, and prostration. And then within a few days or weeks, you get a secondary pneumonia, usually streptococcal
Mhm.
pneumococcal pneumonia. And that's what kills you. It's the secondary pneumonia that kills you a week or two after influenza infection. I've seen so many people die of influenza and then the pneumonia that you get from it. It's not a head cold. Don't confuse influenza with rhinovirus nasopharyngitis, two completely different illnesses. And to take your chances with influenza, even if you're young and you recover from it, it's going to kick your butt for a week or 10 days. You're not getting out of bed. You're not going to work, and you're going to feel like hell for 10. Influenza is not a mild disease. It can be in some people, but if you get influenza, you can expect to get really sick, and you don't need to. Just get immunized.
Mhm. Yeah.
My wife
And
and I have gotten the vax for flu for, I don't know, 20, 25 years and haven't gotten it.
Yeah.
And there is a good workplace trend that I don't know if it's decaying or not, but it used to be when we were younger that it was considered good to go to work a little bit sick. It showed you were tough. And then over the starting maybe 20 years ago, your coworkers were like, "No, go home. You're going to make us sick." And that is a good trend. You shouldn't go to work if you're sick with something communicable. And I don't know with the politicization of disease whether that trend has remained as strong. Like I don't know in MAGA strongholds if it's considered praiseworthy to go to work when you're actively sick.
I don't, I don't know. I advise people when they have respiratory infections not to go to work because they're just going to make everybody else sick. And as I've been also in my life, I've worked in leadership roles and been responsible for large organizations. I was the CEO of a medical group that had 350 doctors and a couple of thousand employees. And it was terrible. And when people come to work sick, make everybody else sick, and then your staffing just goes down the drain. Everybody calling in sick, you don't have staff. That's terrible in a hospital or healthcare setting when you have doctors or nurses or medical assistants or others who you depend on in the organization, and they can't come to work because they're sick. It cripples the organization. Sometimes we even had to hire temporary work to make up for the people who were out sick. So sick outs are a bad thing, and let's prevent all of this just by vaccination.
Yeah, I went ahead and did a COVID vaccine, also a booster. Should people be getting boosters, or if you already have it, say, hey, forget the booster because I already had a vaccine? Or should you get the booster? I went ahead and did it, but what's your thoughts?
Yes, I would recommend do exactly as the ACIP, the CDC, ACIP, with Dr. Robert Malone just recommended that everybody get vaccinated for COVID. They just recommended that. So they are right. You should do that. Get vaccinated because the CDC, ACIP recommended with the caveat that you talk to your doctor about it, as if we didn't have that caveat before.
Mm-hmm. Yeah. So it is important to get the booster on COVID, because a lot of people out there, when there was the mandate and when I was traveling, I actually had to have Vax cards, or I couldn't travel in Europe. I had to present them to Italy many times going through Italy. It's a real pain. But since all that's disappeared, people have to actually voluntarily stand up and go to a pharmacy or a doctor to get the COVID vaccine. But because there's not a push on that or a mandate anymore, are we going to see people not doing the booster, and are we going to see more infections and possibly more deaths on COVID this year?
Yes. I mean, only 14% of people are getting vaccinated. Vast majority of people are not taking the advice of the experts. They're not taking the CDC's advice and other expert advice. They're just disregarding it. Most people are not getting. The anti-vaxxers have succeeded in scaring off the majority of Americans from these vaccinations. So what we're going to see, the recommendations I've made this morning, the things we've just been talking about, most people are going to ignore. And so what we're going to see is very bad respiratory infections soon, very soon.
So COVID doesn't kill as many people as it used to, because at this point, like 95% of the U.S. population has either gotten vaxxed, boosted, and or had COVID. And so if you've had it before, the severity may not, or been vaxxed. I got it for the first time after 5.5 years. I'm highly boosted. And I tested positive for 2.5 weeks, but the symptoms were not terrible. And I'm hopeful that it didn't do permanent damage, because it really tears up a lot of your body systems. That's COVID, not the vaccine. The vaccine does not cause damage.
Right. Yeah.
But the deal is, if you get COVID repeatedly, even if they're mild cases, it does cumulative damage.
Yes, that is true. As far as the vaccine causing, the toxicity from the vaccine, and there are so many people who are making a fortune off of that. That's basically a snake oil salesman gimmick. This idea that there's spike detox and long vax and all that's all made up BS. That stuff doesn't exist. And what you have is you have a bunch of doctors or some doctors who've had their licenses revoked or their board certification revoked, who can't make a living being doctors anymore. So they've gone into the spike detox treatment scam. That is just a money making scam, and they're making tons of money selling this idea that the vaccine makes you sick and that you need to take these herbal supplements to cleanse your body from this spike, from the inflammation from the spike vaccine. That's all just, that's you might as well be selling just, Jinsu steak knives online. It's all just a gimmick.
Yeah. The other thing, when it comes to measles, there was an MMR vaccine that I remember getting when I was a kid. What's happened to that? From what I understand, there's some movement that you have to separate those three.
Yeah,
Is that true, or can you just do one? I thought doing one MMR seemed to make sense.
that's a bad idea. And CDC, the ACIP, I was, kind of being sarcastic before when I was saying that we should follow CDC's advice and Dr. Robert Malone, because they did in fact recommend COVID vaccination, but they also made dumb recommendations. Like they recommended that hepatitis B vaccination be withheld until 12 because it's sexually transmitted. They forgot about transmission in pregnancy and vertical transmission because they don't have the backgrounds in it. And even Trump came out and said that in his dumb press conference. But they also want to separate out the components of the MMR vaccine because they say that, they believe that it's all these vaccines lumped together that are causing autism, which isn't true. And it's actually better to get the vaccines together. You're protecting. When you separate these things out, people don't follow through. And you got to get people in the office. You got to get them while you can. So anyhow, that's another bad recommendation.
So they've done, I mean, anybody can do a study, but they've done studies that show that the autism epidemic is mostly an epidemic of people being aware of autism symptoms. That if you control for symptoms across decade by decade, people with the percentage of people with the most severe symptoms is a constant. We just find more people with autism because we're more aware. Like 10, 20 years ago, very little autism in girls because we didn't know it, because it presents differently in girls. Now that we know what it looks like in girls, we find a lot of autism in girls. It's also, there's money available to help your family if you are diagnosed with autism. That increases the rate of diagnosis. We don't have a real epidemic. The percent of people with it has remained fairly constant.
That's right. It's a matter of recognition, diagnostic recognition. The planet Pluto was just discovered in the 1880s, I believe, but I suspect it was there before we discovered it. We just didn't know it was there.
Right. Yeah. So what people should be looking at, and seriously, they have to get off their rear and go in and get a flu vaccine, get off their rear and go get a COVID vaccine, because nobody's going to do that for you. You have to take your own initiative to do that. Would that be correct, Dr. Pattons?
And the investigative journalists out there need to get off their rear and actually vet the credentials of the people giving these recommendations. There are people studied throughout HHS in healthcare now who are fake experts with resumes that are grossly exaggerated, embellished, even containing fabricated content. We have frauds and fakers and charlatans in positions of power, and they need to be exposed.
There are all other good vaccines. If you're older, you got shingles vaccine, you have pneumonia vaccines, and if you're a kid, there's I forget the name for the genital warts.
HPV.
Yeah, there you go.
Yeah, that prevents cancer. That's a cancer preventing vaccine. If you've ever seen, cervical cancer used to be, there was a time when cervical cancer was the number1 cancer killer of women. Well, that started to go down after the pap smear. Now it's a preventable disease. Just get vaccinated against HPV. Women, no one should die of cervical cancer.
And unfortunately, I think we're going to see quite a few people this year die of the flu, die of COVID, that don't have to die if they took the vaccine. But there's no lawsuits because the best witness has just passed away. So, in other words, they can't complain. Dead people don't complain.
This is likely to be a bad year. We'll know for sure as the months unfold. But with the decrease in vaccination rate, I think and the fact that the people are all scared of taking vaccines now, I think we're going to see a very bad winter with measles and rubella and all the contagious infectious diseases, and especially COVID and influenza. I'm expecting a bad season. I hope it's not, but
You
Look
never
for
know.
50,000 plus influenza deaths this year.
So
And this is
one last
important.
thing,
Yeah,
one
go on.
last thing is that the charlatans like to say, well, if you have side effects from a vaccination, that's the vaccine attacking and damaging your body. No, though, that's your immune system responding to the vaccination. If you feel a
Right.
little achy, that's a good thing.
Yes,
Yes.
it is.
And we'll be reporting this on Medicine and Science on the Pod TV network in the United States, and of course our broadcast around the world. And we'll see you next week on Medicine Science, only on the Pod TV network. Take care. Bye-bye.